research can be done without jumping through many big hoops. So that's,
Certainly.
yeah, the view we see on that is we take the same stance as the American Medical Association, that it should be reduced in its scheduling to a lower schedule so that it can be more accessible for research.
I would say that, you know, in the case too with people with, you know, cancer in some cases, I mean, doesn't marijuana smoke tend to produce a much heavier tar than, say, a cigarette?
So
See, that's the thing, is there's different forms of actually utilizing marijuana. So you can actually the vaporizer, you can consume it as like in food and things of that nature. So the big issue is a lot of
like
the people.
brownies?
Yeah, I mean, yes, so that can be one of the things. But a big issue is the smoking component of it. So there's other forms of utilizing it that actually negate smoking. So you can, the THC is what you want, and THC is what you get without the smoking. So even if it is for terminal care of cancer patients, or say AIDS, as a palliative agent, it's, you think about it, if it makes the patient feel better, the benefits outweigh the risk in that sort of regard.
And THC itself is actually an expectorant, so it has positive effects to the respiratory system.
Okay.
It's the other components of the plant material, when burned, can they cause minor problems.
Okay.
One common way to alleviate that is through using a vaporizer, which all it does is it at a certain temperature, the THC is vaporized before any of the plant material is, and so you can smoke that and eliminate all of the risks, but you still retain all the benefits of like the immediate action of the marijuana, which is an important part of why Marinol isn't a sufficient route to administer
Because
this.
it's synthetic, it's not...
It's synthetic and it takes a longer time for it to work.
So is there any way that you can extract, or is there any other source of THC besides marijuana? As far as, because what we're really talking about here is the medical benefit of THC, not getting high.
Which is legal and well established, actually.
Correct. So if with regard to the THC, why does it have to be a legalization of marijuana? Is there any other delivery form of THC that's available? Obviously, marijuana would be the most common, given how...
Right. Well, with Marinol, that is what you have. As far as I know, even though it is synthetic THC, it's not a synthetic analog. It is THC itself.
Okay.
So it's the same compound. It's essentially what would happen if you took a marijuana plant and purified the compound from the plant. But the issue is you can no longer inhale that form, and it's just too volatile.
I think the structure of Marinol is slightly different, so it's going to have different effects on the cell biology.
It still produces the same mental effects.
Yeah, it is similar, but it's not exactly.
Yeah.
As I was, go ahead.
Oh, I was going to say, could it, is there possibility, say, like, you have albuterol inhalers. They're very common. They have a propellant side of it.
There is a new drug that is a kind of a nasal spray that's coming up that's in trials right now.
Okay.
So the effects haven't been seen yet,
Okay.
or haven't been studied yet. But a lot of people are interested in the side effects of marijuana. And there was a report that was a meta-analysis that was released a couple days ago, and the side effects are very mild in the pill form of THC, and also in the smoke form of marijuana. And it's very mild, like sensory effects, and the worst effects of marijuana overdose, if you can consider it overdose, is just psychosis. So there have been no deaths. There have been no deaths related to the primary cause, or having marijuana as a primary cause, whereas other drugs used in place of marijuana, such as antispasmodics, antiemetics for cancer patients, they've caused 10,000 deaths, as the drugs themselves have caused 10,000 primary deaths. So marijuana is safe overall.
Yeah, back to your question, kind of what we were talking about before with the vaporizing system, that effectively is an inhaled version, but it's based off of the natural plant compound. So versus pharmaceuticals would be more synthetically prepared, and at the moment there is no inhalable substance on the market. Tony was talking about some up and coming ones, but at the moment many patients prefer to receive THC through the natural compound just because it can be inhaled. And when you're talking about treating nausea or vomiting or other or trying to improve appetite. These are things that patients would like to do in the moment. So taking a pill and then not being able to eat for 4 hours, especially if they're vomiting, they may not even be able to keep that pill down. That's kind of the main benefit to the natural system.